I work for Hauora Tairāwhiti, and I'm going to talk about poverty, give a brief description in terms of the context of what I'm talking about. I'm going to paint a picture of what that means for Tairāwhiti in health and wider, and then I'm going to give you the Tairāwhiti kaupapa, and it picks up some of the questions and some of the comments that have been said today already. I think we all know in the room what poverty is, so I'm not going to labour the point, but suffice to say that it is multi-causal and we need multiple solutions. There's no one solution. So what does poverty mean in terms of health? And again, I think everybody in this room knows. But what I want to stress is that it is cyclical. Children who are born and grow up in poverty live as adults in poverty unless we can make a difference. The Dunedin longitudinal study found that children who were born in the most socially, economically deprived families were more at risk in terms of drug and alcohol addiction as adults, more at risk in terms of poor cardiovascular health, more at risk in terms of dental health and other health issues than children who grow up in the most socially, economically privileged families. And we need never to forget that. There's been talk already today in terms of deprivation, so again I'm not going to labour this point, except to say it's tough out there in Tairāwhiti. It is tough. I think it's also important to look at family type in Tairāwhiti. There are studies both internationally and nationally that show that children who grow up in a sole parent family are more likely to experience poverty and distress and isolation and stigmatisation than children who grow up in two-parent families. Again, we need to remember that. And again, there's also been talk about employment. Two things I want to note here. One is, just because you're employed, it doesn't mean to say that you're earning sufficient to live. It means for some people you remain stuck. You remain part of that poverty cycle. And I applaud the growing noise and some real action around living wage. Education is also really important in terms of opening the door, moving away from that poverty cycle. Education qualifications give you more opportunity. And yet again, here in Tairāwhiti, there are differences. Look at the no qualification. Look at the overseas secondary qualification at the other end. What are we doing, or what could we be doing to turn that around? And at the end of my presentation, I'll be talking about some of the Tairāwhiti kaupapa solutions. Yeah. So what does that very brief picture, and it's a very brief picture of Tairāwhiti, look like from a health perspective? This slide here is talking about the national death rate, which is the blue line, this one there. And the green line is the death rate in Tairāwhiti, a difference. Drilling down, if we look at Māori and non-Māori in Tairāwhiti and nationally, again, you can see this difference for us here in Tairāwhiti, Māori or non-Māori. And I want to go to this slide now. This slide, I think, has left a lasting impression on me. It looks at life expectancy across the District Health Board regions. Average life expectancy, 82 years. Waitemata, 85 years. Tairāwhiti, 78 for those years, for those at the back who couldn't see it. Again, picking up on the themes from this morning, these are our issues. And the end of my presentation will talk about the Tairāwhiti kaupapa, which has the beginning of solutions. I'm actually now going to focus on children a little bit, because children are our future. They are the future of our society, of our community. and they are our treasures. Are we looking after them? This slide shows the health of our 5-year-old children and their teeth. Caries-free is a measurement which looks at the absence or not of decay and infection. This goes to 2011, but when I checked with our dental services, whilst our caries-free has improved, we are still below the national average. Breastfeeding. I think, again, we all know the importance of breastfeeding. It protects the pepe from infection. It is the best nutrient that a child coming into this world can have. And most importantly, it is the beginning, after those first 9 months, of that real bond between the mama and the baby. And yet, when you look at our breastfeeding rates, and again at 6 months, the picture is pretty much the same. Birth weights. I'm going to talk a bit later on in terms of obesity, but this slide just shows the difference in birth weights at birth. Poverty is about not having sufficient or the right nutrition. The breastfeeding, the birth weights, all relate back in some shape or form to whānau and families not having sufficient and the right nutrition during pregnancy. And we've got a solution for that, and it will mean Te Aotearoa clamp, but we will be asking the politicians to listen to the solution. This is a slide about obesity. Kids across the country, before they go to school, have a before-school check. One of the things that they measure is the weight of the child. In Tairāwhiti, this is the last 12 months up until April 2011. In Tairāwhiti, only 51% of our children, before they go to school, have a healthy weight. We have a problem. We owe it to ourselves if we would truly believe that the kids, our grandchildren are our future. This is something that together we also need to work on. Rheumatic fever. This is indeed a third world disease, and yet it's alive and well in Tairāwhiti. There are indirect connections between poverty and rheumatic fever, poor quality housing, overcrowding. In 2014-15, Tairāwhiti had the highest rate of first-time rheumatic fever hospitalisations in the country. In 2016 and 17, for us it's in the DHB, it starts on 1 July, we've already had 2 such hospitalisations. And it picks up, and I want to talk further later on, the comment around retrofitting. Again, the solution is there. People need to listen in Wellington and locally. We need to own it locally, we need to talk about it locally and make sure it's heard in Wellington. Smoking. I've included smoking in this because this is another preventable behaviour. It is decreasing, but again, it is something that we can do something about. Now I want to talk about moving from the worst to the best, because we can do it and we've started doing it. I deliberately painted a grim picture of Tairāwhiti, but it's only half the picture of Tairāwhiti. And we have started coming together in terms of solutions. Cancer registrations. You may think that this line going up means that it's all bad. It's actually not, because what it means is that people are being diagnosed earlier with cancer, are being treated earlier with cancer. And that for us is health starting to make a difference. And again with heart conditions. Health again is starting to make a difference in terms of what health can do on its own. But health can't do it all on its own. Definitely can't. As I said right at the beginning, poverty, the impacts of poverty and changing the curve belongs to all of us. We have a responsibility and we have an accountability. And here's some of the solutions, Mr. Ming. Retrofitting in housing. We know it works. Recently we looked at where the retrofitting had happened across Tairāwhiti. And I want to draw your attention to these three areas here. Rotorua, Tikaraka and Paratahi. Simply because in terms of their decile rating, and I want to show you on the next slide, there's something we measure in the hospital called housing preventable hospital admissions, which in English actually means if the housing quality had been of a sufficient standard, there's every likelihood that those hospital admissions wouldn't have happened. And again, just looking at Rotorua, Paratahi and Tikaraka, all the hospital admissions have gone down. There is a real and clear direct link between retrofitting and hospital admissions. Now this is a centre of integration. No one can do it on their own. We've got to do it together, but people like me and a government agency need to remember my place. Health doesn't have the answers. Health is an enabler, is a facilitator, but it's not the driver of the answers. It is not about all the government agencies down the one driveway. And I know that there's been a lot of talk about that, but we actually have to make it really happen. That the right car with the right people is down that driveway asking the people at that house, what do they want? What matters to them? And for health, if health is going to adopt that philosophy, we've got to change our model of care. And Hauora Tairāwhiti is trying to do that. We're a big beast and it takes a long time to convince all of us that this is the right way, but it is beginning to happen. We need to disinvest in the hospital, move it out to the community, move it out to general practice. The board has supported this change direction, and what Hauora Tairāwhiti did 12 months ago, we refreshed our values, really thought long and hard and consulted and talked to lots of people about who we were, what was our future. And this is what we've ended up with. And again, the important thing in that is working together. That's a very busy slide. But what I really want to say about this slide, that this is one of the solutions that has been in place since October, November of last year. We realised that the traditional mainstream way of doing services for -9 months from conception to 5 wasn't making a real difference. So what we did was actually work with the community, work with the whānau who told us what they wanted in terms of their pregnancy, in terms of what they wanted, in terms of their support for the first 5 years. And Itipi Hauora was born. It is led by 3 Māori providers, Tūranga Health, Ngāti Porou Hauora and Te Atanga Hauiti Hauora. They are the face of this. It is a community-developed initiative, and it's adopted a model of whatever it takes. Whatever the people that are accessing this service need, there will be it's a limited pūtea, but there is a pūtea to support. And interestingly, in the last report, it showed that even though the health dollar at this stage is actually funding this initiative, most of the pūtea has gone to support whānau in terms of getting a driver's license to actually be able to get to services, nappies, food, not specific health. And I think that's the way we need to go in the future. It's listening to what the whānau want or the families want, and they are telling the providers what they want. Oh, the other important thing about this slide is we're moving away from trying to measure outputs and outcome and inputs to actually measuring outcomes. What is really going to make a difference? And this is picked up on the earlier conversation around social investment. Utopia doesn't only measure health outcomes. Our next stage, by working with our partners, is to actually measure health and well-being outcomes. This again is another answer to your question, Te Aotearoa. This is an attempt, and I want to acknowledge the interest and the support of Treasury and Ministers Tolly, Coleman and English in terms of listening to the community. This is an iwi-led initiative which has the government, the chief executives of government agencies coming together and really testing the concept over the next 12 or 18 months, lessons of really working together, not just talking about working together, really working together. Healthy Families East Cape is another initiative which is here and showing that we are beginning to really work together in Tairāwhiti. Another way of showing the Tairāwhiti kaupapa. It is 2 DHBs, 18, 19, I think, other providers, 8 iwi who've come together to look at ways to turn the curve in terms of poor lifestyles, poor nutrition, obesity, insufficient physical activity. And the important thing about this is that this initiative is also iwi-led, iwi-owned and iwi-driven. And particularly the DHBs are in there in a support role, but not leading. And that, in my view, is one of the ways of the future. I've only talked about 3 of the quite a number of Tairāwhiti solutions. These are a number, and some people in the room can talk much more knowledgeably about these initiatives than I can. But each of these has at its kaupapa community engagement, community-owned, iwi leadership, government agencies coming in behind. So I guess it is about coming together. It's not about talking coming together. It's about doing what this slide does, which is actively coming together. These solutions have been born out of, supported and confirmed by the cross-sector work, activity, discussion that's gone on in the last probably 2 or 3 years. And I want to acknowledge Leslie's role in terms of that, in terms of driving a lot of that. So we want real, intensified, real cross-sector activity. To do that, there needs to be, and acknowledgement to the Ministers Tolly, English and Coleman again, in terms of the licence that they are developing with Tairāwhiti, with the social governance group, to actually do things a Tairāwhiti way. But I think the message back to Wellington's, give us the chance to trial this. We'll get probably a large part of it right, but we'll make some mistakes. But let us keep going. Don't do let's knock Hauora down on this, because Hauora wasn't, in my opinion, hasn't been given the opportunity to actually really explore its huge potential. Another really practical solution, and picked up on something someone said this morning, is, and we've started the conversation with WINS, what if for those who most need support services, and I don't like using the word vulnerable or at risk, because those are negative labels. What if we could come together with a package that built on the wahakura, a package of care from conception right through to 2 or 3 years of intensive support, whatever that young whānau or that young mama wanted. And with our experiences of i te Perea, it's not huge what they want. But we could do that quite easily, and that is a conversation that we'll continue with WINS and then take back to Wellington. So again, a very simple solution, and with iwi. The other thing that's really important, and I want to tell my fellow Treasury presenter, certainly Treasury does have a heart, that's brilliant, but when you do your analysis, can you also include analysis around traditional practice, not just best practice in a mainstream way. Because that's the other thrust of Hauora Tairāwhiti. By not doing the same old way, we are saying we want to recognise Te Ao Māori frameworks, and that is particularly important in Tairāwhiti, given our demographics. And we've started doing that through the Healthy Families East Cape Collective, through the Mahi Atua work, which has been led by Dr. Diane Rangahuna around not just mental health addictions. It's about telling your stories, relating who you are and where you want to go to your stories. And that is another solution. Government agencies just need to listen to the people of our community who can take a lead on that.